The emergency department. Okay, tell the truth. Please, we need to know what actually happened or what you really did. If you've been taking Tylenol every 2 hours, we need to know if we're going to do right by you. If you did heroin today, tell us. If you fell on something, be upfront about it. Be honest. It actually helps us direct your care. It tells us something about your medication tolerance, explains why your vitals might be abnormal, and keeps us from giving you medications that would hurt you. We have serious rules against sharing your secrets, and we're not going to tell the police if you use drugs. We are just here to help, and we can help you better if we know what we're actually dealing with. Okay? Waiting is tough and almost guaranteed in the emergency department. Be glad if they don't rush you back, because rushing you back means you have a higher chance of death or limb-threatening condition. If it's busy and you get a room immediately, it means the staff are worried about you and they are focused. Follow their instructions because they are working for your health and well-being. If you are waiting, it doesn't mean that the ED staff don't think you are in pain or that your problem isn't important. There are only so many beds and staff. Safety rules demand that a physical bed can only be used if there is someone that you can care for. Everything takes time. Testing, procedures, seeing the doctor, who is seeing people beside you, medications. It likely won't be quick. Here's the bright side. You don't need an appointment and can show up any time of the day or night. Our mission is to care for everyone that arrives as best as possible. Triage is how we figure out who to treat first and how quickly. Triage means to sort. The goal is to take 5 minutes or less so that we get to the next person quickly. This will be the first of many times that you will tell your story. The most important two people who need to hear your story are the triage nurse and the doctor or medical provider. The ED is so busy that things are done in steps and repeated at times. This increases the chance that we don't miss things. We know from experience that new information gets out when people tell their story a few times. We know it's annoying, and you should know that we are trained to put safety first. The ED is not first come, first serve. Even if you've been waiting for 2 hours, if someone comes in with chest pain, not breathing well, or has a bone sticking out, they are going to cut to the front of the line. So if you have a sore throat, yes, the guy with the rattlesnake bite that came in way after you is going to leave the lobby first. While you're waiting, you can make it better for yourself and your loved ones. Take a moment and list your medications on a piece of paper or get pictures of your medicine bottles. List your past medical problems and surgeries. Describe in words your symptoms. Fill in the sentence. This part of my body feels. Since. And every time. Help us help you. And if you know of a better way, put it in the comments. Healthcare workers in the ED are doing their best and are often not treated well. They are rarely given positive feedback or compliments. Grace, patience, and kindness is likely to supercharge your experience. Expect them not to tolerate anything that might be abusive, rude, or even bitchy. There is a rising trend of violence against healthcare workers, especially in the ED setting. For this reason, many EDs now have security on staff 24/7. It's not uncommon for healthcare workers to experience verbal abuse, getting hit, bit, spit on, or having things thrown at them. Some have even been stabbed and shot. Imagine yourself working for 8, 10, 12 hours in a row and think, do I want to be spoken to in this way? Imagine trying to revive a dying child before going to the next patient who might be throwing a temper tantrum. They are trying to be there for you in the best way they can be. They don't have any superpowers compared to any other human. We understand that it is hard to wait, be sick, be in pain, be uncomfortable, and endure all the poking and prodding. We know it isn't fun. However, any type of violence, whether physical or verbal, is taken seriously in the ED. If you have frustrations, be sure to let staff know in a reasonable way, and know that we will attempt to resolve this issue. Remember, treat others as you would want to be treated. No one likes getting kicked in the face. You probably won't get every test that you saw recommended on Google. Your ED doctor's goal is to make sure you don't have an issue that needs medication, hospitalization, or surgery right now. There are a few reasons for this. One is not all the available tests can or should be performed in the ED. MRI is a perfect example of a common test that isn't done in most EDs. Some tests need to be sent to special labs or performed in a different setting or by a specialist. Also, the test you need to address today's problem varies, and this is where your doctor comes in. Their exam, your vitals, and your overall presentation provide clues that help your doctor decide what to do next. For the sake of time, it's not reasonable for the doctor to run every possible test. Not having a diagnosis can be frustrating, but some symptoms can be very vague and hard to pinpoint a cause. Dizziness, chest pain, and abdominal pain are common examples. You may get referred to a specialist for further workup. If you're being sent home, that means your doctor feels that you are safe to do so. Also, note that if you feel worse, you can always come back. Expect not to eat. This is a big one. For many reasons, your doctor and nurse will want your stomach to be empty and stay empty. Believe it or not, we have to play the game of does this patient need surgery or sedation? And believe it or not, for safe anesthesia, your stomach actually needs to be empty for at least 4 hours. After all, who wants a chewed-up burrito to come up from the stomach and into their lungs halfway into a surgery? So if that belly pain you have turns out to be appendicitis, but you've been snacking away, it's actually going to delay the problem being fixed. Also, many other illnesses, such as nausea, vomiting, or high blood sugar, can be worsened by eating and drinking. Experience in medical science has shown us that you will be okay if you don't eat for a few hours. We're not trying to starve you. We have good reasons. Every important detail about you isn't in the computerized medical record. Top secret. The records are not always correct, and looking through them takes time. Many of the people who work in medicine look things up after they speak to the patient. We are trained to hear it from you firsthand. Your words usually contain more information than looking things up on a computer. For one thing, we listen and watch how you speak. This tells us how several of your body systems are working, so we gather the information we need to care for you. Sometimes electronic records between hospitals are connected, but don't assume that is the case. So take the time to remember where you were seen and when. Bring records from those other places if you have them and offer it. Expect that the ED probably won't be able to fix your chronic problem. Yes, we understand that you have had this issue for many years and that it is making your life difficult. While that is frustrating, not every chronic problem has a solution in the ED. We can direct you to a short-term solution, perhaps physical therapy or some medication, but generally your doctor's options are limited or very few. We can't make your arthritis go away. We can't reverse the effects of a 40-year-old smoking history. If we could, that would be great. Some things are fixable and some are manageable, and that is subjective. Everyone has a different tolerance for pain and discomfort. Realistic expectations are helpful. If you came in with a 10 out of 10 pain, and we can get you down to a 7 out of 10, that's progress. If you came in wheezing from your COPD, and we can ease your breathing, count that as a win. The ED is in the business of helping find solutions, but we can't always work miracles. Expect that CPR does not look like it does on TV. There is no long beep when someone flatlines. And despite what you see on TV, if you shock someone who has flatlined, asystole in ED terms, they won't come back to life. CPR is actually a very aggressive procedure that is done when someone no longer has a pulse and is not breathing, or, as we say, arrest. CPR is most likely to be successful when the arrest is witnessed and CPR is started within 10 seconds. If they are in a rhythm that is shockable, and all of them are not, then giving them a shock ASAP can help. So if you see someone arrest and you aren't at the hospital, start CPR as soon as possible and call 911. Don't wait for the paramedics. Start doing compressions because time is heart and brain. And CPR doesn't work every time. Many times, even with great ACLS in a hospital setting, the person does not survive. Sometimes they do, but their brain has been damaged from lack of oxygen. And of course, there is the issue that caused their heart to stop in the first place. Those that survive will also have to endure the injuries caused by compressions, which will include broken ribs and even punctured lungs. Basically, when you wake up, it's going to feel like you got hit by a car. Good compressions usually break ribs, but CPR does not always save lives. There are many factors at play, and while you are wondering, why have I been waiting so long in the lobby? Just know that this could be the reason. They're doing CPR on someone. Be thankful it's not you. Also know that your healthcare worker may have just spent the last 30 minutes with a family that lost their loved one. Be kind.